sprains are common. I know when we're playing sports, you have a bad fall, you get an ankle sprain. And I don't know personally, but ladies, when I see you guys in those high heels, in my head I'm asking myself, man, they're asking for trouble. One uneven surface and boom. So 2 years ago, I sprained my ankle. I got a grade 3 sprain. I tore my anterior and posterior calafibular, which are the two main ligaments in your ankles, and it required surgery and 1 year of rehab. So how do we treat these sprained ankles? Well, there's 3 main steps in how to treat them. Apply ice, compression, and elevation. First, get a bag of ice, or an ice pack, or if you're old school, bag of peas. And apply the ice to the ankle sprain. Don't directly put the ice on the sprain. Make sure you want it in like a bag or something. And don't apply the ice for more than 20 minutes at a time, because then you'll get frostbite. And not only you'll have an ankle sprain, now you got to explain how you got frostbite in Northridge. According to the American Orthopedic Foot and Ankle Society, ice is essential to prevent further inflammation or swelling. And it helps balance the blood circulation in your ankle, because there's so much blood and bodily fluids already in that swelling, you don't want any more. Second, obtain ankle tape, wrap, or some sort of cast. I like to use the air cast rather than those wraps. They just get so annoying taking it off and on, but those work too, about like this. And make sure it's wrapped, it's compressed tightly around, and make sure you wrap it up within the first 24 to 36 hours. This is really important because right when you sprain your ankle, most of the swelling happens in the beginning. So the quicker you take care of it and the longer you take care of it, the less swelling you'll have over time. So make sure it's on tight, but not too tight. You don't want to cut off the circulation of your blood. If you feel like a tingling or some numbness, it means it's on too tight. So you might want to loosen it up. So according to WebMD, compression helps to keep your ankle immobile so that you can put some slight weight on it. Now remember, the wraps aren't really a form of like protection. They're more just like a reminder of you to be careful and not, use your ankle too much. Third, rest your ankle and make sure it's always elevated. And keep your foot elevated above your heart rate, above your heart level, because obviously the heart pumps blood throughout your body, and the more blood that gets pumped through your ankle, the more swelling you're gonna get, and that's not good. So what it does when you lift your ankle, it's harder for the blood to reach to the ankle swelling. So according to Dr. Harvey Danziger, the reason for elevation is to also stop the swelling. And he says that if you don't do this, it could result in some kind of internal bleeding, which you don't want that on top of an ankle sprain as well. So according to the American Osteopathic Foot and Ankle Society, 25,000 people a day get an ankle sprain. Now it's hard to control a fall or an uneven surface, so what I like to do to prevent any type of ankle sprain is when I'm playing sports, I like to have an ankle brace. It's really comfortable for any sport, and also just getting the right equipment. It's not the 1950s anymore. We should stop playing sports and working out in our Chucks or Vans. Go out, get some running shoes. I have mine on. It's much more comfortable, and you don't want to sprain your ankle. It's just not a good thing. And so pretty much, remember, if you do sprain your ankle, follow these 3 steps. Apply the ice, compression, and elevation. And of course, if the lab coat didn't give it away, I do want to become a doctor. I'm interning right now in Santa Monica with my friend's dad. He is an osteopathic surgeon, so I'm learning a lot, and it's great. And hopefully in 10 years, I'll become a doctor. But what sucks, if I become a doctor, none of you guys can come see me, because I can't fix anything that's already perfect.